Okay, it's probably been like 2 months since the last time I had an electrolysis appointment. I'm trying to find a new electrologist because the one I was going to, she's having some kind of procedure, so she's not like available right now. And I had a consultation yesterday with another electrologist, and she was telling me that, well, she works at like a clinic where there's doctors and they do actual like lidocaine injections to make it less painful so that they can use higher energy to destroy the hair. So I never really felt like topical lidocaine did much for me, and it just like I don't think it really helps. It only helps with like surface level pain, but the probe is going deeper into the skin where the hair follicle is, so just topical lidocaine I think doesn't really help. I think injectable lidocaine would help, but like it hurts just getting it injected in the first place. It's like it burns and it stings and then it gets numb, and they have to inject, I'm sure, like multiple places, so I feel like it's not even worth doing the injections. I would rather just go without the lidocaine injections, and that's what I plan on doing. So I haven't scheduled yet, but I have to schedule an appointment with her and see how it goes. So I'm not sure if like using a higher energy is going to be like better necessarily, because the point is that the hair has to be like in the growth phase when you're destroying it, and it's not always going to be in the growth phase every time you go, which is why it can take more than one appointment. But if it's possible that like she could use higher energy and it will destroy the hair faster, then maybe I would do that. But like, I don't know if I'd be able to tolerate that without lidocaine, but I really just don't want lidocaine, so I don't know. And I've gotten some comments on other videos where people are like, oh, you should get laser is better. Well, laser hair removal has the effect, especially on darker skinned people for some reason, of causing something called paradoxical hypertrichosis, which means the laser is actually stimulating more hair growth. And so for places that are hormonally regulated, like facial hair, I don't think that's a good option. Maybe it works better for people with fairer skin and different hair types, but for me personally, I didn't have like as much of a permanent effect with laser hair removal as I have with electrolysis, which is why I think I can't even speak, electrolysis is superior. So I always say, like, if you're gonna get like hair removal on your face or your chin, your jawline, things like that, I think electrology is better, and it's going to actually be permanent once the hair is targeted during its growth phase. So that's what I'm going to keep doing. And it's, like I said, it's probably been like 2 months since my last appointment, and this is what I look like right now. Like, there's a lot of it like over here, and this side isn't that bad. I don't know if this lighting is even that good, but it's so annoying. And like, it tries to grow back ingrown, and that's why I get like these dark spots. But then after a treatment, when the hair is actually removed, I don't have those dark spots anymore. So that's literally just from the hair itself growing, and it's so annoying, and I just want it to be gone permanently. So hopefully I'll be able to get scheduled soon with my new electrologist, and hopefully it will go well.